Have you ever wondered how your body reacts after anal sex? Specifically, what changes might occur to your anus after this activity? This may be a sensitive topic for many, but understanding your body's natural responses is essential to ensuring your health, safety, and overall comfort during the experience. Equipping yourself with the right knowledge will help you feel more confident, reduce risks, and take better care of yourself. In today's content, we will delve into the various changes that might occur to your anus following anal sex. You will learn why these changes happen, whether they have any long-term effects, and how to care for your body effectively. Additionally, this video will provide some useful tips to help minimize discomfort, reduce the risk of injury, and maintain comfort after each encounter. Make sure to watch the entire video to discover an important secret that will help you protect your health and optimize your personal experience. And don't forget to hit the subscribe button today so you won't miss any useful videos about sexual health, relationships, and many other important insights. 1. Temporary sensitivity or discomfort. After anal sex, many people may experience sensitivity and slight discomfort in the anal area. This occurs due to the unique physiological structure of the region, which is surrounded by firm sphincter muscles and contains numerous sensitive nerve endings. During intercourse, these muscles are stretched to adapt, and then require some time to return to their normal state. As a result, you may feel a sense of tightness or mild pain immediately after the sexual activity. Typically, this sensation lasts only for a short period and gradually diminishes as the body recovers. To alleviate the discomfort, you can apply several simple measures. One effective method is to apply a cold compress to the anal area for about 10 to 15 minutes. This helps reduce swelling and soothes the tense muscles. Additionally, soaking in warm water is another good option, as warm water helps relax the muscles and stimulates blood circulation, thereby speeding up tissue recovery. Using an adequate amount of lubricant throughout the intercourse is also crucial, as it helps reduce friction and minimizes damage to the sensitive skin. Furthermore, during intercourse, you should perform movements gently, at a slow pace, and always listen to your body's responses to avoid overburdening the anal sphincter muscles. If the sensitivity or discomfort persists for too long or becomes more severe, you should pause sexual activity to allow your body time to recover and consider consulting a doctor for timely advice. 2. Mild swelling or redness. After anal sex, many people may notice that the skin around the anus becomes swollen or slightly red. This is a natural response of the body due to increased blood flow triggered by the stimulation and pressure during intercourse. When the anus is stretched, the small capillaries in the area may dilate, leading to temporary swelling or redness. In most cases, this is a normal reaction and will resolve on its own within a few hours without any intervention. In addition to increased blood flow, strong friction or insufficient use of lubricant can also cause the anus to become irritated, potentially increasing the extent of swelling or redness. People engaging in anal sex for the first time or without proper preparation are more likely to experience this condition, as the surrounding tissues are not yet accustomed to the stretching. Points to note: although swelling or redness is usually temporary, if it lasts for more than 24 hours or is accompanied by severe pain or burning sensations, it may indicate that you have experienced irritation or minor injury. In some cases, this might involve small abrasions or soft tissue inflammation, especially if intercourse was vigorous or prolonged without adequate lubrication. If you notice signs of infection, such as increasing pain, significant swelling, an unusual odor in any discharge, or prolonged bleeding, you should consult a doctor promptly for advice and treatment. Ways to alleviate: gentle cold compress. Wrap a clean cloth around an ice pack and apply it to the anal area for about 10 to 15 minutes to help reduce swelling and ease discomfort. Soak the anal area in warm water. This helps relax the muscles, stimulate blood circulation, and promote faster recovery. You can add Epsom salt to the water to enhance its anti-inflammatory effects. Avoid additional friction. Limit wearing tight clothing or fabrics with rough textures that may further irritate the anal area. Maintain good hygiene. Gently wash the anal area with warm water and a mild soap to prevent the risk of infection. Use moisturizing or soothing cream. Some creams containing ingredients like aloe vera or witch hazel extract can help soothe irritated skin. If the swelling or redness does not subside after 24 hours or if you experience any abnormal symptoms such as severe pain or prolonged bleeding, you should seek medical advice promptly. 3. Appearance of blood spots or slight bleeding. After anal sex, some individuals may notice the appearance of small blood spots or slight bleeding. This typically occurs because the rectal mucosa is more delicate and sensitive compared to other tissues, making it more prone to injury when stretched or subjected to strong impact. Even minor damage to the mucosal layer can cause bleeding, resulting in the presence of small blood spots following intercourse. Generally, this phenomenon is only a temporary reaction and does not pose any serious danger. However, the main cause may be insufficient use of lubricant, overly vigorous intercourse, or an approach that is not well suited to your body. For those who are new to or unaccustomed to this activity, the likelihood of injuring the rectal mucosa is higher. Additionally, factors such as prolonged tension and pressure during intercourse also contribute to making the mucosal layer more susceptible to injury and bleeding. To manage this situation, it is extremely important to use a good quality and sufficient amount of lubricant. Lubricant helps reduce friction, facilitates the recovery of soft tissues, and minimizes the risk of injury. Moreover, you should engage in intercourse gently and gradually to allow your body time to adapt to the stretching. If you notice blood spots or slight bleeding after intercourse, it is advisable to pause sexual activity to give your body time to recover. Other supportive measures include maintaining proper hygiene in the anal area by using warm water and mild soap, as well as avoiding tight clothing or fabrics that might irritate the skin. If possible, gently applying a cold compress to the anal area can also help reduce swelling and soothe any injured tissues. However, if the bleeding persists, becomes more severe, or is accompanied by symptoms such as intense pain, significant swelling, burning sensations, or signs of infection, such as an unpleasant odor or the appearance of abnormal discharge, you should seek medical attention immediately for prompt examination and treatment. Early intervention can help prevent complications and protect your sexual health in the future. 4. Temporary changes in bowel habits. After anal sex, some individuals may notice a temporary change in their bowel habits. Specifically, you might feel the urge to use the restroom immediately after intercourse or observe a slight alteration during bowel movements. This primarily occurs because the anal sphincter, the muscles responsible for controlling the contraction and relaxation of the anus, remains somewhat relaxed after being stretched and stimulated during intercourse. These muscles require a certain period of time to return to their normal state, which is why your bowel habits might be temporarily affected. When the anal sphincter muscles are stretched, their ability to maintain control can diminish slightly. This reduction in control may lead to changes in the regulation of the anal contractions, resulting in a quicker urge to defecate or a sense of discomfort during bowel movements. However, this is merely a temporary phenomenon that usually resolves on its own within a few hours once the muscles contract back to their original state. To support the recovery process and maintain the health of the anal area, you can adopt several simple measures. One effective approach is to practice pelvic floor exercises, such as Kegel exercises, which help strengthen and enhance the elasticity of the pelvic muscles. Regular practice can help the anal sphincter recover more quickly, improve its control, and restore normal bowel habits. In addition, maintaining personal hygiene after intercourse is very important. Gently washing the anal area with warm water and mild soap can remove bacteria and reduce the risk of infection, thereby promoting the rapid recovery of the stimulated tissues. This practice not only minimizes discomfort but also helps maintain overall comfort in the anal area following intercourse. If, after a few hours or even a day, your bowel habits have not returned to normal, or if you experience other abnormal symptoms such as persistent pain, burning sensations, or prolonged discomfort, it is advisable to monitor the situation and consider consulting a doctor for timely examination and advice. Early intervention can help prevent any undesirable complications and ensure that your sexual health remains safely maintained. Thus, while temporary changes in bowel habits after anal sex may cause some concern, they are a natural and temporary response of the body. With proper care and recovery measures, most individuals will quickly return to their normal routines without any serious issues. 5. Risk of infection or irritation. The anus does not naturally lubricate itself like some other parts of the body. And it is an area with a high density of bacteria due to its exposure to the external environment. Therefore, if proper hygiene is not maintained after each sexual encounter, the risk of irritation or infection increases significantly. Bacteria can invade the soft tissues of the anus and rectum, leading to inflammatory reactions, irritation, and even the formation of small sores or blisters. Symptoms such as pain, swelling, burning sensations, and even slight bleeding may occur if the infection spreads. This not only causes discomfort but can also negatively impact your sexual and overall health if not addressed promptly. To protect the health of the anal area, it is crucial to maintain good hygiene after intercourse. Be sure to thoroughly clean the anal area immediately after sex using warm water and a mild soap, ensuring that you carefully remove all bacteria, bodily fluids, and residue. In particular, if you use sex toys or other sexual devices, make sure to clean them thoroughly both before and after each use. These items should be washed with warm water and soap or disinfectant according to the manufacturer's instructions to prevent the spread of bacteria. Another effective measure to reduce the risk of infection is to urinate immediately after intercourse. This action helps to flush out any bacteria that may have entered the urinary system, thereby reducing the risk of urinary tract infections. Additionally, using wet wipes designed specifically for the genital area can also help maintain hygiene and prevent bacterial growth. Furthermore, using an adequate amount of lubricant during intercourse is very important to reduce friction, minimize tissue damage, and prevent skin irritation. When combined with proper hygiene practices, these measures will significantly reduce the risk of infection and effectively protect your sexual health. If you notice any abnormal signs such as severe pain, prolonged swelling, redness, or symptoms like fever or an unpleasant odor after intercourse, seek medical attention immediately for proper examination and timely advice. Early intervention can help prevent dangerous complications and ensure that your health is optimally protected. Golden tip after anal sex. Always listen to your body. If you experience any discomfort or notice abnormal symptoms, pause to allow your body to recover. Ensure proper hygiene. Use plenty of lubricant, and communicate openly with your partner for the safest and most comfortable experience. If you find this video helpful, please like and subscribe to the channel for more educational content on sexual health. See you in the next video.